HealthFirst Top Doctors podcast. Today we're exploring the science and arts of facial aesthetics with highly respected maxillofacial and facial plastic surgeon, Miss Natasha Berridge. Thank you so much for joining us today.
Thank you for having me.
How are you doing?
I'm well, thank you. How are you?
Really well. So excited to find out a little bit more about what we're talking about today. But before we do that, could you tell us a little bit more about yourself and your work?
Well, thank you for the kind introduction, and I think you've pretty much hit the nail on the head. I'm a dually qualified maxillofacial surgeon who works as a consultant both within the private sector and the NHS. My private practice is focused primarily on my subspecialty interests, which are gender-affirming facial surgery, otherwise known as facial feminization surgery, aesthetics and facial plastics, and also the management of facial skin cancers and other types of dermatological surgery.
Fantastic. Okay, so let's get started with the questions. Number one, what are the biological processes that can cause our skin to age? And are there any external factors that can accelerate this process?
That's a really good question, Carolyn. And I think in short, there are two answers to this. So we all naturally go through aging. It's the natural genetically programmed reduction in cell turnover called senescence. And so what we see there, which is a biological process, is the reduction in cell turnover. As a consequence of that, the reduction in fibroblast activity and therefore a reduction in the amount of collagen and elastin production. And how this manifests itself, this will manifest as fine lines, wrinkles, the scent of the soft tissues, just the quality of the skin not quite being there, in general overall facial deflation. And on the other hand, you asked about environmental factors, and indeed there are environmental factors that certainly contribute to skin aging, aging in general, and on a whole, primarily these are the effects of chronic ultraviolet light. So chronic sun exposure. We know that chronic sun exposure reduces the activity of our cells. It leads to abnormal elastin production, solar elastoses, and just the general quality and the texture of the skin. Now, in addition to that, there are lifestyle factors that also contribute to worsening effects of facial aging, skin aging, and these are things such as pollution, smoking, alcohol excess. So all of these things have contributory effects on the general natural aging process.
Yeah, absolutely. I think it's easy to say, well, this is just part of life, but at the same time, there are ways that maybe you can modify your exposure to the sun, your alcohol intake, things like that. So the next question, what would you recommend for someone looking to age gracefully? And what simple methods or things can people do in their day-to-day to help with that?
That's another really good question, one that I'm always asking myself as well. So what can we do to age gracefully? So we cannot halt the aging process. I just want to make that really, really clear. We can't do that. As I mentioned before, it's a process called senescence. It's a biological, genetically programmed process. But there are things that we can do to modify and enhance our lifestyle. We spoke about external factors. So our exposure to the sun, for example, we know that sun habits over the years have drastically changed. We've seen that with the advent of more and more, particularly in my patient cohort, patients wearing SPF, so sun protective factor. And I always tell my patients, in fact, it's a routine that I follow myself, despite the fact that I am naturally dark skinned, but I wear SPF 50 on a daily basis. Now, this will reduce or protect the skin actually against the harmful ultraviolet rays. The other thing that's really, really important is to make sure that we are keeping ourselves really well hydrated. Good hydration is essential for the skin barrier function of skin. It's a protective mechanism that helps with the integrity of our skin. Another really important thing is sleep. I think we're all guilty of not getting enough sleep, but if you think about it, if you sleep, you're resting. And if you're resting, you're then resting the biological processes as we sleep. And then just being really mindful about our lifestyle factors. So what are we taking into our bodies, and making sure that our nutrients are going to be healthy towards our gut health. And all of these things are contributory positive things that we can do to contribute towards aging more gracefully.
Fantastic. Okay, so how do Botox and dermal fillers work, and who might be an ideal candidate for these?
So I get this question a lot. So there tends to be two cohorts of patients. I've got patients that come in and are against surgery for many reasons. And then I have patients that come in and they are purely interested in the injectable side of my practice. And it's a very common question. How do Botox and fillers work? And they actually work very differently. So if you think about it, botulinum toxin is a product that works by temporarily inhibiting the activity of the muscle. So if we think about the face has a huge amount of mimetic muscles that help us with dynamics, with expression, day-to-day emotion. But what can happen as we age is that there can be hyperactivity of these muscles. And as one is aging, the overlying paintwork, which is the skin we've mentioned, declines in its quality and its robustness. So if you think about a muscle that is chronically activated, and then the overlying paintwork is constantly moving, that is going to lead to lines and wrinkles. The way in which botulinum toxin works is that it reduces the activity on a temporary basis of the muscle, and as a consequence of reducing that activity on a temporary basis, the overlying paintwork is not moving as much. There is less creasing, so to speak. And if we translate that into how the skin will look, that leads to less dynamic lines and wrinkles. So that's botulinum toxin. Obviously, Botox is a trade name, and the actual product is botulinum toxin. Dermal fillers, on the other hand, are made on a whole of hyaluronic acid in the purest form. So this is chemically processed and produced. And what hyaluronic acid does is that it is a naturally occurring substance within the body, and actually in the greatest quantity within the skin and the extracellular matrix, and it attracts water. So the action of dermal fillers that are hyaluronic acid gels is to attract water. And by attracting that water, you are restoring any lost volume, and thereby restoring the lost volume, you're improving the projection of the area in which the dermal filler has been injected. And that can be injected into many different layers. Now, that layer might be within the skin, and by attracting water within the skin, you're going to get a skin that has improved quality, improved turgor. It can also be injected into the fat and deeper onto the bone. And if we think about facial aging is a three-dimensional process. It's not just within the skin that we age in all layers of the face, the skin, the underlying fat, the ligaments age, and certainly with bony aging, what we start to see is bony resorption. But that's where dermal filler really comes into its own. It's to restore lost volume, and by restoring lost volume, it improves contour and projection.
Wow, that is like such detailed explanation. Like, I feel so much more educated, because it's spoken about a lot, you know, in popular culture, for example, with Botox especially, and you just take it as like I don't know, like it's like you were talking about three-dimensional, it's a bit of a one-dimensional thing to talk about, but that is just so clear. And thank you so much. That's really, really interesting. When might surgical interventions be more appropriate than non-surgical treatments? So what are some of the specific procedures available, as well as their benefits and potential risks?
Another really, really good question. And there are so many factors that come into play here. So patient factors, surgical factors, financial factors. But I think if we are to purely take the question in its most basic form, those patients that have advanced changes, and what I mean by that is that they are on a spectrum of having facial aging changes that are classified as moderate or severe. To achieve their expected goal of total facial rejuvenation, and as I said, there are many caveats to this because an individual's expectations and an individual's goal is very specific and unique to that individual. But in relation to the question, those with moderate to severe changes will benefit the most from surgical intervention because surgical intervention will address the moderate to severe skin laxity. It is an excisional process of excising that laxity. It will also address any underlying structural changes. Now, facial plastic surgical interventions might involve, starting from the upper part of the face, a brow lift. It might involve an upper blepharoplasty. It might involve a mid facelift. It may well involve fat reduction, an upper lip lift, a lower face and neck lift. On the other side of that, you have those that present with facial aging that isn't as severe in appearance. Those with more mild changes of facial aging are actually those that just want something that's much more preventative. And for those patients, they might well be looking at non-excisional procedures, minimally invasive procedures, such as maybe fat and liposculpting, so liposuction, fat reduction, skin tightening procedures. There are very many good skin tightening therapies that are on the market that really give rather nice results in certain areas. Now, the under part of the face is a very good area that can respond quite nicely if you have mild to moderate changes in that area to skin tightening, submental fat reduction, otherwise known as liposuction. And that's essentially the difference between the two. But yet again, this is a very highly personal want and desire for a patient, because I've seen patients in my clinical practice that have severe changes, and for whatever reason, they don't want to undergo the knife. They don't want surgery. You just have to be really, really honest with your patient, and it's about setting expectations. And that's the conversation that needs to be had between doctor and patient right at the start of that patient journey. And then the other options that are available need to be discussed, if at all.
What are some common misconceptions you encounter about facial aesthetic procedures, and how do you address these concerns?
Carolyn, you've got some great questions today, and they're really, really very clinically relevant. I get patients come into clinic, and this is a real concern for them. And I think a much more common concern in those patients that are seeking interventions with injectables, so botulinum toxins, HA fillers, as opposed to my surgical patients. And I'm quite passionate about this because there is no reason at all why a patient should look distorted, why a patient's natural anatomy should be distorted and ridiculed. And the simple answer is that facial aging is a diagnosis, and it's all about understanding and appreciating anatomy and form. And there are a number of various options out there to address the various aspects of facial aging. And it's that correct diagnosis and correct product choice that all contribute towards a very natural outcome and look. I can't emphasize enough that with correct and precise anatomical placement of the correctly chosen product. There is no reason at all why patients should look distorted, unnatural, and unfavourable after entrusting the process in their medical practitioner. So I very much reassure my patients that facial rejuvenation is very much about achieving naturally visible results.
Fantastic. Okay, so the final question. What emerging trends or technologies in aesthetic medicine are you most excited about, and how might they improve outcomes in the near future?
I think we're living in a really exciting time of advances in medical technology, and certainly within the space of facial aesthetics. There are so many new technologies that are emerging. But in answer to your question, I'm particularly excited about the regenerative therapies that are out there. And by that, I mean the new advances in radiofrequency technology. I mean the new advances in the biostimulatory treatments that are out there, and how these differ to what we have traditionally been used to, that regenerative processes and products that are actually using the body's own repair mechanism to deal with facial aging. So it's a really, really exciting time. And what I would say is watch the space.
Fantastic. Thank you so much for speaking to us today. It's been a pleasure.
It's been an absolute pleasure. Thank you so much for having me. I've been able to talk about a topic that I'm truly, truly passionate about.
Brilliant. Okay. So, if you're interested in discovering more about facial aesthetic treatments that could assist you, arrange a consultation with Ms Berridge via her profile at topdoctors.co.uk.